Consumer Reports magazine, for the first time in their history, decided to do a tremendous amount of research and then grade hospitals across the country for their patient safety. So they measured 6 different areas: how well we take care of patients when they come to the hospital, how safe the patients are when they come to HealthAlliance Hospital. So we thought we would do well. And it turned out that we were ranked the safest hospital in Massachusetts by Consumer Reports magazine.
We're talking Massachusetts here, which is known for its fine medical care and wonderful hospitals. So that is quite a coup to come in #1.
It certainly is, Barbara.
And we in the
very
community,
proud.
Yeah, we're very fortunate to have HealthAlliance in our community. And safety is an issue that people have a tendency to take for granted. You think, well, I'm in a hospital, of course I'm going to be safe. But HealthAlliance doesn't take it for granted, do they?
Not at all, and I think you've captured it pretty well. People often think about preventive medicine as something you do at home and a hospital, a place you go to get well. But when you think about it, the time you're most vulnerable to have a complication is when you're sick. So the hospital is very interested in preventive medicine as well. And the ways they think about doing that on every day, every touch with the patient, when you have an IV placed in your vein, we're very interested in preventing an infection into your bloodstream. And the process we put in the last few years, recognized by Consumer Reports, have resulted in no infections of a deep central IV in the past 3 years. Similarly, if you have a tube placed in your lung at your sickest because you need to be on a breathing machine, same sort of thing. There's a tendency to get pneumonia, and that pneumonia can be catastrophic. And through the efforts of the teams that involved, there hasn't been only been 1 pneumonia of this type at HealthAlliance in the last year. So I'm aiming for 0. One
of the other awards we received just 5 days after the Consumer Reports magazine was published, the American Hospital Association told us that once again we're one of the 100 most wired, 100 most technologically advanced hospitals in the country.
And we've covered a few of these points on here, but Dr. O'Leary, maybe you'd like to talk, what is this Tier 1 hospital for quality of care and affordability? Did we really go over that yet?
So the Tier 1 is recognition is that when the patients have a choice of hospitals to bring themselves or their loved ones to, the hospitals are ranked. And if you're a Tier 1, that means the patient can get their care here, and it's recognized for quality indicators and also for affordability indicators.
All these things we're talking about being most wired, and we have an item here, the electronic health records. How does that help the doctors do their job?
I think a little bit of an analogy to, you know, in chess they have a professional who's an expert. And then they developed a computer called Big Blue, and guess what? The computer always wins. And so in healthcare, at HealthAlliance, we tried to put the computer and the expert on the same side. And the computer lacks personality, and the expert provider can use all the computer has to offer. So as an example now, when you're at the bedside and you want to order a medication, and you type it in, which is more legible than the old days. Several things. First of all, the patient is identified properly right away, so you know who it is. It takes away the possibility of error. And then you're alerted quickly to what the patient's been doing. You have access to their previous hospitalizations. You have access to if they've been in our parent UMass Medical Center recently. You can see allergies. The computer can say, wait, stop for a moment. Think there may be an interaction between the medicine you're thinking of ordering and what the patient's already on.
At HealthAlliance Hospital, we deliver about 1 million doses of medication a year, 1 million doses. So some of those are the same patients, but it's 1 million doses. So it's a physician prescribing a dose of medication, the pharmacy delivering that dose of medication, the nurse administering that dose of medication. So all of these human elements are involved in the medication process 1 million times a year at HealthAlliance Hospital. If you have an error rate of 1%, that's 10,000 medication errors a year. So we were just about in that range prior to the administration of what we call MAC, Medication Administration Check, which computerizes the whole process from the physician electronic order to 5 writes have to line up. So we use bar scanning on the drug. Every drug has a bar scan on it. If it doesn't match to the patient has a barcode on their wrist. If the drug doesn't line up with the patient at the right time, at the right dose, the medication cannot be given. So when we've gone to this electronic medication administration program, from 10,000 errors a year, we've gone to, as Dan said, almost 0. And if you figure most hospitals are operating between 1% and 2% error rate on medication errors, we operate at about 0. And that's what allows us to be A-rated with patient safety, Tier 1 hospital measuring quality. That's how we get these awards.